Hello everyone. Welcome to the next video in our series. So we got a lot of interesting feedback, and I'd like to share with you that we had a lot of queries about gender identity issues, which probably we just did not include. So in this time of your early 20s or mid 20s, do you get to meet women or men who just come with very basic?
Yeah, I think that is a huge issue, and if you don't mind, we need to spend a little bit of time, a couple of minutes, addressing this. We all know, what we are as a boy or a girl when looking at somebody, but there is something more than that. The mind determines how you feel about yourself. So that is something that needs to be acknowledged. And you have talk about gay, lesbian relationships. Different cultures look at it differently. Some people talk about that as a character issue, but I think there is something more than.
And I guess we get a lot of inspiration from the movies, right? So, like sometimes even my teenager asks me, what's gay, what's lesbian, and as parents, sometimes we're not able to address the issue.
I think this is one of the very common things where you can see the body and the mind working together, and if they are not aligned, you will have an issue with your gender identity, and it's a huge problem. And in fact, it's a hugely under-recognized problem around.
And they don't know again whom to go to, isn't it?
Absolutely. So even in the Western world, this is a hugely problematic subject, and they don't have many health facilities to address this. And I'm sure in India, it's coming up in a big way.
Yeah.
And so this has to be recognized. And thank you for our viewer for this very
as a gynec, sometimes you get what we call primary amenorrhea. You have a 20 or a 22-year-old, seemingly a woman or a girl, but then she hasn't attained her menstruation, her periods. And then when you start examination, you find that there is no uterus. She's actually not a female, but a male.
Absolutely.
But, so that.
And I've known of people who have been interested in the same gender. But, when you're a girl, your parents might naturally want you to get married to a boy.
I think the first reaction is anger, and the parents want to just...
Exactly. And when would they come out? Coming out is a huge issue. And I've known of people who've been successful in then breaking off the relationship and, having a relationship with the same gender, if they're comfortable with it. But I guess it takes a bit of a time in the society for it to change. But what I think we need to emphasize in this conversation is these are the real conditions. And, there is no excuse for ignorance.
So you need to reach out.
Exactly. And if you don't know, ask. And there are specialists. Look up, research, accept.
Accept.
And that's very important.
And
I think it's a message
to accept,
exactly, for the parents and doctors as well. And I think there are situations where doctors have been ignorant as well, because we never learned about this in medical school in great detail, to be fair. So, that's...
or sometimes we just tell them, no, you're a girl, be a girl. Yeah. This is right, wrong. So that concept of what is right, what is wrong also is important.
So maybe we should then now go into looking at the influence of the mind in the several stages of pregnancy. So probably, you get somebody who stops period. That's probably the first sign when they think they're pregnant. Is that still the case? That's going back to a medical school. That's all I know.
Of course, but it's also changing because with all the Google and information everywhere. In fact, I get young couples who have done this blood test we do, beta HCG. So they come with the blood test report. Okay,
so they're advanced.
Sometimes they're advanced that way. Sometimes they even don't know till the 3rd and 4th month.
Sure.
Planning pregnancy is very important. Especially with the millennial generation, they plan everything.
Yeah.
Isn't it? So like life is an Excel sheet sometimes for them, but some of them plan their engagement, this is one of my favorite topics, they plan their wedding costume, the decor, the color, the space and all of that, but they fail to plan pregnancy, where, you're actually passing on your genes to the next generation. So it's really important.
So are there sort of few things our viewers can pick up in terms of what's the sort of look for, in planning? I guess having sex is a requisite for pregnancy, and that's first. And then what else do they do? What else do they
Exactly. See, even there, many of the times, you get infertility, where they have difficulty in conceiving. So they just married for 2 or 3 months, but there's so much of pressure, and we actually start investigating only after 1 year of unprotected intercourse. Right? So don't be in a hurry. And if it has been a year and you've been trying and you're not able to get pregnant, then you have a series of blood tests that we advise. There is an ultrasound. semen analysis is important. So all of that does happen. And when you get pregnant, then there are certain vaccines which you should have taken pre-pregnancy, you know, like a rubella vaccine or a chickenpox vaccine if you have not had the infection before.
And is that period a happy period, sad period, cranky period? I know some people have excessive vomiting.
Everything together, you know. There is no one size which fits all, you know. Like you have very intelligent women who come and they are like, no, I'm able to work, I don't need bed rest, you know. These days pregnancy, maybe there's so much of pressure and expectation. You have the in-laws, you have some neighbor who has had a good or bad experience, you have some well-wishers who tell them, you know, don't do this and do that. Girls and women are very intelligent nowadays. So
but
just
is
let them be.
pregnancy an illness or a wellness issue?
Pregnancy is a wellness issue, but you know, because of so
but there
much
are complications
I guess
as well.
we've just, there are complications,
because, you know,
but then you have to let things just, you know, just be.
Because, you know, going back to nature, obstetricians is a relatively new concept, but human birth has been there forever, right? So I'm getting a feeling that if pregnancy was managed well, then probably the need for high level or high risk obstetrics.
So one of the things I, you know, always tell, I don't even like to call pregnant women as patients because they're young women, right? So they have to avoid 4S, I tell them during pregnancy, that is extra salt, extra sugar, and lack of sleep and stress. And how they do it is, you know, that's a journey with me. So.
That's very, very useful because, you know, if you go back to my undergraduate days, all that I remember is, you know, hypertension during pregnancy, diabetes, gestational diabetes,
injections
they call it,
and iron and calcium and things like that. No one actually.
So then, from what you say, if we take care of that, those things can be avoided. I think at the later stage of pregnancy.
Exactly.
You know?
No, it's not just later stage. It's from, that's what I'm telling.
Well.
Preconception and even beginning. I think pregnancy is a time when women can really, you know, they can take health in their hands, and it's a time for the entire family to become, you know, healthy. Like you have young couples who are living alone, they order Uber Eats or Swiggy or whatever, and then most of the time it's either biryani or pizza or whatever, processed Chinese food. But when they get pregnant, every grain they put into their body, they are so conscious about it, which is really good.
You talk about nutrition there, sleep, stress. Again, you're coming back to the issue around
See, you have gadgets all the time. Instead of one, there are two phones, you have an iPad, you have a laptop, everything is just next to your head. So, you know, even in the hospital when they get admitted, you know, the woman gives birth and there's one phone here, one phone there next to the baby. I tell them, please get all of that.
Even in this most common thing of pregnancy, the mind takes over here, I guess. There's a lot of influence of mind. But then I also want to briefly pick up on what happens soon after delivery. Now, it's a very difficult period because generally in my practice, what I tell people
even nowadays, in fact, the concept is, you know, the word delivery, only pizzas are delivered, it's birth. Now, whether the birth is a normal birth or a cesarean birth, I am no one to say which is better. Okay, both are better in their own ways depending on each individual circumstance. Right? But that entire process has to be a pleasant experience, you know. So many young women are so scared of the entire, you know, concept of, because again their moms or grandmoms would have told, you know, it's all natural, or they tell them eat for two, or they tell them don't move, you know. So pregnancy is not an illness. It's a very enduring, and you have all these Bollywood celebs, you know, like you see Kareena Kapoor, you see all of these women who've had, you know, they've really enjoyed their pregnancy, stay active throughout the pregnancy, keep active, don't be on a bed rest unless you have some complication where your gynec is advised to just keep active.
I get encounter a lot is people who are, as I say, delivery or given birth, and there is a sort of difference in the hormone levels, I guess, you know, once the baby is out. And they go through what we call as blues. Or sometimes they have depression. Do you see that quite a bit?
As gynecologists, sometimes we really don't know how to deal with blues, because that's a time, you know, even when, I mean, you would be able to tell better how to deal with that, because we just tell a woman, this is the best time of your life, you're supposed to be happy, why are you sad? How do you address that?
That is the worst thing anyone can hear. You know, imagine you're a woman, you're going through something very difficult as that.
I have myself, you know, heard that, and I have myself also said that.
Exactly.
So
I think it's being very mindful of that. That's the last thing a woman wants to hear, I suppose.
You know, when they're really going through a lot of emotional change, they want to cry all the time, they're upset, and you know, once well-wishers are like, why are you sad? So is it okay to be sad? Can they be sad?
Because if you are feeling that way, it has to be that way, and that has to be acknowledged, and support offered. I think that simple intervention can go a long way, even before you call a mental health specialist.
So you caregivers, people at home, just tell them it's okay to be sad, it's okay to cry.
I would even go
Does
as
that
far
make a
as,
difference?
Of course, and also go as far as the professional doing a screening for postnatal depression. And there are several questions you can go through systematically, which puts the lady at ease. In the Western world, all women
undergo through that.
Yeah. But here, even if you ask some of those questions, they feel so reassured that someone has acknowledged some of their feelings.
Sometimes it's just the body language you have to understand. Just need to ask.
It becomes a factory just giving birth.
I think that's for the professionals also. Big time. Understand and just pick up and just ask basic questions, right? Are you feeling sad, or is there anything else you want to share with me? At the end of the day.
And this is a real issue. It's not just the girl is now slumped with the responsibility of a child. It is a hormonal issue. It's a physical issue.
So does it go away, blues, or do they need?
It can be managed. It can be managed, and of course they need a lot of support, nutrition, water, sleep, so on and so forth. But again, that is a huge topic.
Is it related to thyroid also sometimes?
There may be, but this is where the professional comes in.
Okay.
I think what I would say is acknowledge that is an issue. If it doesn't go away easily with the home remedies, as they call it, seek professional help. And again, professionals should be sensitized to this
Like we
issue.
call it TLC, like tender loving care. That's something that
exactly. So
probably
pregnancy,
women need
not
it more.
illness. Yeah, you agree on that?
Wellness, absolutely.
Wellness. So pregnancy and after childbirth, just take it easy. Enjoy.
Yeah.
Yeah, cool. Thank you.